COVID treatments, statistics, and myocarditis. Welcome to another episode of Ask Dr. David. I'm David Berger, a board-certified pediatrician, where we are constantly striving to share things about health, education, and choice, and we really like to emphasize on the educational part. So I have some questions that have been posed, so let's dive right in. Okay, so question number one. What is Paxlovid and when is it available? So we heard back at the end of last year about antivirals that were coming up. There was one being put out by Merck, one being put out by Pfizer, and the one that's called Paxlovid is the one that scored almost 3 times as high in terms of reducing the severity of the disease in people who are hospitalized and people high-risk people who could be hospitalized and dying, whereas the Merck one was showing success about 30% of the time. The Paxlovid was showing success about 90% of the time. So, of course, if there's a choice between the two and someone feels the need for this, that's a very big difference in a statistic of almost like 3 times more efficacious in order for out of the Paxlovid. So we talked a little bit about this before, but I also have some more information. So in terms of what it is, it's referred to as a C3-like protease inhibitor. So a protease is involved in breaking down proteins. Anything that has an ACE in it, you're typically breaking it down. It's an action. And so it inhibits the breakdown of the proteins that are needed to form the COVID virus. So what this does is it basically stops the replication of the virus. Now, also, it is something that is only available by prescription. And we had heard that there will be very limited availability, at least for the first few months. So we are showing on the screen, as well as going to be sharing in the description section down below. This is a very interesting page because it actually shows you where you can get the different types of treatments that are available. So we've homed in here on Hillsborough County, the Bay Area, just to make the point. But what you will see here is actually showing how much is available relative to how much was allotted. So you'll see, like for Paxlovid, how many in the different locations that have it. You will also notice that they listed not just for the pharmaceutical antivirals, but they also listed monoclonal antibodies. So we did talk a couple of shows back about how the main monoclonal antibodies that have been widely available and that we were really suggested made a lot of sense were no longer working. But there are 2 other ones that are working. And so you'll see them listed here. And again, you'll see where you can get them at. So again, another option. Again, we're all about having choices. So, of course, many people will not need additional help to get through Omicron. We know that. And, of course, people who follow our protocols and, of course, which we've shared multiple times, really in terms of helping boost the immune system and lowering the inflammation to get through it. But, again, having this tool available, but also, this is also something that people can show their doctor, or when if they're getting a prescription, they may be best as opposed to having it called into somewhere or that they may not have it. Having a written prescription where at least the patient can then use a source such as this to say, oh, they have it over here. Let me contact them specifically to see about if their availability is still there and whether I qualify. So another tool, another great thing for us to have. Glad we have it. Okay, so the next question is, where are we at in the Omicron wave right now? Okay, so we are sharing here the data from Florida. And what you will see here is over to the far right, that's where we're at now, like up to the day. I think this is just a couple of days out. And you will see the different spikes that show up each time from the original variant, again, Alpha, Delta, etc. And then, of course, this huge spike that we saw in Omicron. But one of the things I do want to point out are a couple of things. Notice how fast that peak has come down. We are not quite all the way down to where we were before this spike happened and started up in November, but we clearly are on our way down. Another thing I want to point out, though, is if you compare it to these other curves, notice how fast it shot up and notice how fast it came down. So the entire length of that wave is much shorter. Now, of course, that was what kind of led to some overwhelming of the hospitals and the healthcare system. But at the same time, it's very good to see that it came on real quickly, went out real quickly. And that's obviously, we have every reason to believe that number is going to keep on going down. And I really do think that unless something unexpected, which in the day of COVID, We're allowed to allow for unexpected and be wrong about things. But at the same time, do I think that when we get into March and into spring, kind of like we did see last year, that we should expect to see the numbers low? Of course, there's going to be one big difference between this year and last year, is that this year, the overwhelming majority of us will have immunity, especially if they have hybrid immunity, which we've learned about. So again, this is all pertains to better information for what our upcoming year will look for, again, assuming no surprises. Now, a couple of other pieces of information which I thought was just interesting, because the percent positivity, and this is something that I looked up specifically for Hillsborough County where I live, because of course, what's happening in the whole state, that's interesting data to kind of get a sense. But like when we're making our decisions that are comfortable of going out, being, more comfortable or not being without a mask, also has to do with how many people around you are sick. And the best number that we continue to find is what's called the percent positivity, which is the number of people who take a COVID test relative to the number of people who test positive. Now, of course, we know that lots and lots of people do home tests and don't report it. We know lots and lots of people who didn't even bother testing. They assumed it, or just because they had cold, they just laid low. But this is still a good number, because the same number of people who appear sick enough or concerned enough would still show up to their primary care doctor or to an ER or an aftercare clinic. So over time, the percent positivity is still a really good number. And if you remember, we were talking about numbers around 5% was kind of like when it was nice and low and very low chance of it being spread through the community from one person to the other. Now, during this Omicron spike, the number went up to 31% in our county. 1 of 3 people who tested were positive, and that's a huge number. Now, as of this week, that number is down to 17%. So almost 50% reduction, still quite a bit above the about the 17. But if the numbers drop the way that we've seen the graph, we're going to clearly be seeing numbers in the single digits in the next couple of weeks. And of course, that's what most people are expecting. And, throughout the spectrum of people who have opinions about this, it does seem that that's one universal thought, is that, will it go down to 0? No. Will it come down very nicely? And will we see a spring similar to like we saw before? Again, fingers crossed, but it certainly does seem as if that's a pattern that's emerging. Okay, next, myocarditis. Now, more data has come out about myocarditis relative to the vaccine, especially the messenger RNA vaccines. Okay. Now, this particular study that you see here, that that you'll see us referencing from JAMA, which is the Journal of the American Medical Association, is looking specifically at VAERS data. That's the Vaccine Adverse Reporting System. This is a self-reporting system that people can put in. It does get verified, but anybody can enter information to it, and then it gets verified afterwards to see how likely that there was a true relationship between getting a vaccine and a side effect, or whether there was not. Now, the cutoff for this particular study was in September of 2021. We're going to talk a little bit more about Omicron after that, but there was some really good information here. So what they first described is that there were over 192 million people over the age of 12 in our country by the time that this in September that had received a vaccine. Okay, and in particular, a messenger RNA. So they weren't looking at the Johnson & Johnson. And of course, we don't have the AstraZeneca here. So these are really specifically talking about the Moderna and the Pfizer vaccines. Now, there were 1,991 reported myocarditis cases in VAERS. And when they actually looked into it, they found that 1,626 of them were really truly met the definition of myocarditis. So a very large percentage of those who reported, was that 80% or so when I'm looking at it, they actually did find that it was an accurate report. Okay, so that means people are accurately reporting for the most part. That's a pretty good number. Now, 96% of the cases were actually hospitalized with myocarditis. But 87% of those people did recover fully and were with no symptoms by the time they were discharged from the hospital. So, of course, myocarditis, when the heart's not functioning well, there's inflammation of the heart. That can certainly cause a lot of problems. That can certainly be a potentially deadly situation. But if 87% of the people have no symptoms on leaving the hospital, then that obviously tells us that the level of the danger of this myocarditis from the vaccine Well, nobody wants that to happen to themselves. Of course, it wasn't bringing things to a fatal perspective. So that's an important thing when we're talking about risk versus benefit. Now, the interesting thing was that the rate of myocarditis was highest at 1 in 9,500 in people. It was, first of all, after the second dose, in people who are aged 16 to 17 and were male. So that's a pretty specific group of people. That was the highest, 1 in 9,500, 9,600, 9,500 of that particular age group. The second highest number, which was 1 in 14,000 people, were in adolescent males, 12 to 15-year-old. So yes, we clearly do see that the adolescent male was the most at risk for developing myocarditis. But again, when making those types of decisions, if the number is 1 in, pretty much we'll call it 1 in 10,000 to 1 in 15,000, that's obviously, relatively speaking, a low number. So obviously anybody who does say, and we do continue to hear that the vaccines are completely safe and effective. Well, completely safe does not mean that 1 in 9,500 people get a myocarditis and that almost 2,000 people are reporting it, 1,600 people, etc. So, if one were to say, to make a statement such as mostly safe and effective, I think that would be closer to what reality would be. But to say that it's completely safe and effective, or just use the terms it's safe and effective, well, we also know the effectiveness part because of the breakthrough infections that has happened. We know that's not there. But also this is clear proof that one cannot say that this is a fully safe vaccine. Of course, catching COVID is not a fully safe thing either. Now, what they actually had said in this paper, so this is again quoting the authors, based on passive surveillance reporting in the US, that's what the VAERS system is, the risk of myocarditis after receiving a messenger RNA-based COVID-19 vaccine was increased across multiple age and sex strata and was highest after the second vaccinated dose, as we said, in adolescents and young men. This risk should be considered in the context of the benefits of the vaccine. That's something straight out of JAMA. So I'm gonna repeat that last line again, and I'm gonna kind of leave that to the eyes of the ears of the beholder in this case. This risk should be considered in the context of the benefit of the vaccine. So it does happen, right? So again, comparing those two things, that's the best we can present to you. Now, in addition, there have been studies. Now, this is coming to the about how dangerous, how likely is Omicron to cause myocarditis, because we know that was something that was being seen in the early variants, for sure in Delta. But this is so I did quite a search over the last few days to see what kind of caseload we're seeing. Couldn't find a lot of data. Granted, we're still just a month in. Often myocarditis and more serious things don't happen until closer to 2 weeks. Once that inflammatory, that cytokine surge, that cytokine storm a term that we haven't mentioned in the more recent, but certainly that's still there. That's what's happening to the heart. Itis, inflammation, cytokine storm, that's what causes it. But there was a study, a paper which you'll see that I've listed here out of the Times of Israel, and this was as of January 10th. Now, they did start seeing Omicron a little bit before there, but there was only one reported case as of then of myocarditis being seen from Omicron itself. So, of course, we will see more numbers come out as we go forward. So this doesn't mean that in the history that only one case of Omicron has caused it, but that's that. But also, I also putting a link for the Hindu Times. So what's coming out of India as well, because again, very large population, very much being hit. And this is their quote. Experts say that there haven't been any cardiac symptoms reported so far, although it's still very early to say for sure. This is relative to Omicron. The previous COVID variants have been influencing heart attacks and other heart-related complications in patients over the last 2 years. However, this particular variant hasn't shown a precipitation of heart complications. So there you go. So again, when we're trying to weigh the risk of the benefit of catching the virus, if you will, and the risk of the benefit of the vaccine, these do put some numbers into some interesting perspective. And of course, we're seeing numbers from reliable sources here, which I think is important, because numbers are numbers. And of course, we've seen across social media and different platforms, all kinds of numbers being thrown out there. But when we have reliable information from like JAMA, it's kind of hard to refute this. So again, keep an eye on, I'll report more numbers on it as we go, but just recognizing that the risk versus benefit conversation is just not the same conversation relative to vaccines as we were talking about during Delta. Okay, so again, I'll let you know about that. So again, wanting to call out to everybody to please subscribe to our channel, join us on our Patreon, join us across all of our social media efforts. Information, the links are all in the description down below. And thank you very much. Have a great day.